Hi everybody, this is Dr. Greg Kramer, Kramer Chiropractic, Livonia Spine and Injury. The last few weeks we've been talking about whiplash. Now whiplash commonly occurs after you've been rear-ended in a car, but sometimes it can happen in sports or even in other types of accidents. But anyways, it's where your head has gone forward and back. We've torn some ligaments. We've already talked about that you should be cleared immediately from an emergency room to make sure there's no brain bleeds. You should be cleared to make sure there's no fractures. Last week we talked about the initial stages, the acute inflammatory stage. You're going to ice. You're going to have your doctor, who should be a biomechanical engineering specialist. He should know how to read not only a regular x-ray, but a motion x-ray to determine the location and severity of any ligament damage. Ligaments hold your spine together. So again, he finds the areas that are moving too much. The ligament has been damaged. It's sloppy. That creates a lot of inflammation, the muscle spasm, and he will typically provide a very gentle, very specific adjustments to the bones that are stuck. So we leave the ones that move too much alone, and we know that by the motion x-ray, and then he gives you an adjustment in a specific, gentle manner on the ones that are stuck. Now, as you start to progress through your care, whether you're at 4 weeks, 8 weeks, 12 weeks after the accident, you're progressing. Your pain should be going down. Your range of motion should be getting better. Now your rehabilitation starts taking over. And again, it's different for everybody. So again, it depends where you're at in your stage. So let's take a look at what happens when you lose the natural curve of your neck. Because that happens very commonly. It's typical after a rear-end accident. We lose the curve. So we look at this picture here, and as you can see, a normal spine has a normal curve, kind of like a banana. The bones are nice and smooth. You have a fat disc. These are your disc space. Healthy, normal curve, healthy, smooth edges. What happens is when a whiplash is we lose the alignment. As you can see, this neck, this black line represents the back of the neck. This person is facing with their nose in that direction. The red line is normal. That's where the black line should be. So what we should be doing is providing procedures and rehabilitation to push gently the black line closer to the red line. Adjustments, exercise, traction. There's a type of traction device that you can use at home. It's called a dinero roll, and it's specific to the patient. You would lie on your back, and this block would be put right about here in this individual patient. What happens is it gently molds the spine in the direction. This is called a dinero roll. It's very specific to the patient. Usually we test patients on it in the office, and once we know that you can handle it, once we know it's safe for you, we actually test it. We actually will take an x-ray with you lying on this dinero roll. It's called a stress x-ray, and that makes sure that we're exactly perfect with our placement, because you're going to be using this dinero roll probably the rest of your life. So this is a type of procedure. Now, if you use this and it hurts you or causes dizziness or nauseousness or too much pain or pain going down the arms, that means it's either the wrong placement, the wrong size of the dinero roll, or you're not ready for it. Okay? The next procedure you will do to rehabilitate that curve in your neck so that you move better, so that you feel better, so you have better alignment, so you prevent disc degeneration is something called a neck exerciser. Okay. Now, this is the neck exerciser. So I am facing in this direction. This x-ray is of a patient facing in this direction. You would put the neck exerciser behind your neck. You would then, depending on your angle, you would then either push down and slowly bring your head back. Or, it depends what the doctor would tell you, you would then push forward, bring your head back, and in rare cases, you would push up and bring your head back. It all depends on the type of curvature, the type of misalignment. Everybody's different. This is not one size fits all. Traction or spinal molding or curve correction devices are not one size fits all. We test you. None of this stuff should hurt you. So some people can handle it within a week after an accident. Some people can't handle it for 3 months after an accident. Everybody's different. So again, we see the red line is the normal curve. That curve is necessary to have a strong, pain-free, flexible neck. When we lose the curve, that's indicative of ligament damage. We want to reshape the curve. We use very precise adjustments. We use precise rehabilitation with a neck exerciser. We use precise spinal molding or curve correction type traction with a dinero roll where we place it here. And then we do in-office work. So again, I'm just giving you an idea what you would do to help correct someone that's had a whiplash where they have a reversal of the curve. And the problem is if you don't correct the curve, you're going to have an 18 times increase in pain and disability. That's what the research shows. When your head is on backwards, and this person's head is on backwards, that is associated with an 18 times increased risk of neck pain and disability and future degeneration. So again, we've covered a few things over the last couple visits. We've covered about getting checked for a brain bleed, getting checked for a fracture. Once that's cleared, you should have a motion x-ray to measure to see if the ligaments are damaged. A motion x-ray is an x-ray where you bend your head down, bring your head back, and go side to side. It's a stress x-ray. It shows us where there is instability. We avoid the unstable areas. We work on the areas that are stuck. We start applying ice immediately, gentle range of motion within the pain-free zone. And then as you progress in your rehabilitation, that means your pain should be going down. Your motion should be increasing. Your strength, your ability to participate in activities that you like to do should be increasing. We gradually introduce curve correction procedures where we're applying some type of force in the form of either a curve correction device like a dinero roll. We use a neck exerciser to slowly reshape the curve because we know that when you have a proper curve, that's the goal, that you will have less pain, less stiffness, less degeneration, and that is pretty standard. Even the surgical community knows that when they have to fuse your neck, if they fuse you in a good proper curve and what they call lordosis, you have better outcomes. And that we are providing non-drug, non-surgical solutions to improve the curve, improve your mobility, improve your strength, reduce your pain, so you can go back to doing the things you want to do. If you find this information helpful on the Whiplash series, do me a favor, just like it and share it with a friend that if you know is anyone that's suffering with neck pain. If you're watching this on YouTube, do me a favor, just check to subscribe. I'm constantly adding information to update my channel. If you have questions, do me a favor, just send them on Facebook. I'll get back to you as soon as possible. Again, I'm Dr. Gregory Kramer from Livonia Chiropractic, Livonia Spine and Injury, and we'd love to see you participate in any of these Facebook presentations, so don't hesitate to ask questions. And everything we do here is to help you live stronger longer. I'll see you next week at 1 on 1:30. Have a fantastic week.